We're really looking at organic conditions. And as you can see, organic conditions will be tested quite a bit in the EMQ because there are lots of specific words and in clinical practice, as part of pattern recognition, becomes very important. So let's look at the first question. A 70-year-old female who has been on doxepin for many years presents with slow movements on face and extremities. The moment you see the word slow movements on face and extremities, you're really looking at dyskinesias, choreoathetoid movements. She has never been exposed to a neuroleptic and has no family history of movement disorders. And you can see by saying never been exposed to a neuroleptic, it's really pointing towards excluding tardive dyskinesia through antipsychotics, and no family history of movement disorders. The other dyskinetic family familial movement disorders include Huntington's. So it's telling me it's not Huntington's, it's not tardive dyskinesia, and when you look at the list, Senile Chorea fits best. So the answer here is Senile Chorea. So what is Senile Chorea? This clinical entity is characterized by a gradual onset of generalized and symmetric chorea with slow progression and specifically excluding mental deterioration, emotional disturbances of family history. It is important to rule out Huntington's disease, of course. Genetic testing is recommended because family history can be inaccurate and distinguishing age-related mental changes from early features of Huntington's disease in an elderly person may be difficult. The next one, 50-year-old man who has been on an SSRI for many years, now has stiffness of his right hand and a low-frequency tremor. It's important here not to jump to conclusions because an SSRI is present. The question here is asking, why would a person who's been on an SSRI for many years now develop asymmetric stiffness in the hand and a low-frequency tremor? Low-frequency tremor and stiffness points towards Parkinson's disease. So the answer here is Parkinson's disease or Parkinsonian symptoms. And stiffness, so this is a bradykinetic disorder as opposed to the hyperkinetic disorders such as chorea or tardive dyskinesia. Parkinson's disease is characterized by a low-frequency tremor, often a pill-rolling tremor, bradykinesia, so stiffness. There are gait abnormalities such as shuffling gait, festinant gait are some of the other terms. The French term marcher à petits pas, which is really, marching with small steps like this. You often find at the end of the movement, they find it difficult to turn. So that's the other aspect of Parkinson's from a clinical perspective that one needs to keep in mind. And in terms of affect, you tend to get either mask-like faces is the buzzword or blunted affect.